Obstructive sleep apnea is a disorder characterized by repeated episodes of upper airway collapse during sleep. During these episodes, the airway narrows or collapses, and airflow stops or decreases despite your continued breathing effort. Because of this, it is primarily considered a mechanical and neuromuscular disorder. When you are awake, the muscles in your upper airway stay active and tight. They hold your airway open like a rigid plastic tube, letting air flow easily to your lungs. But the moment you fall asleep, your body changes. Your muscle tone naturally decreases. That firm, rigid tube relaxes, turning into a highly collapsible, flexible structure. For millions of people, this relaxation goes too far. This is the core problem of obstructive sleep apnea. The relaxed airway narrows or folds entirely shut. Your chest keeps pulling hard to breathe, but because the airway is completely sealed, no air can pass through despite the aggressive suction. That loud, heavy snoring you might hear from someone sleeping is the sound of air struggling to squeeze past that physical roadblock as the body fights for oxygen. Some people naturally carry extra weight or pressure around the neck, which pushes inward on that already vulnerable, flimsy straw. If you have excess fat tissue around the neck, a narrow jaw structure, or a naturally large tongue, that airway is under severe stress. A family history of these traits also passes down the same risks. Obstructive sleep apnea is, at its root, a mechanical and structural vulnerability. If you have these physical traits, your airway is at high risk of structural failure the moment your brain powers down for the night. Doctors classify these blockages into two main types. The first is an apnea. This near-total failure drops airflow by 90%. Here, the tube opens slightly, but still restricts airflow by at least 30%. This is enough of a chokehold to cause a measurable drop in your blood oxygen levels. Whether the passage is completely clamped shut or merely pinched tight, the outcome is exactly the same. Your brain is suddenly starved of oxygen. Down in your lungs, oxygen levels drop and carbon dioxide starts to build up. The brain senses this shift and treats it as an immediate threat to your survival. To save itself, the brain forces a brief emergency arousal. It signals the muscles to violently contract, snapping the airway back open. This usually sounds like a sudden gasp, a snort, or a choking noise as air rushes back in. The most insidious part is how hidden this is. Breathing resumes, the brain instantly returns to sleep, and you have no memory of waking up. But once you are asleep again, the muscles relax and the airway begins to collapse all over again. Patients often go through this suffocating cycle of collapse and panic 30, 40, or even 60 times an hour, completely destroying any chance of deep, restorative rest. The immediate result of having your sleep fractured dozens of times an hour shows up the next day. You wake up with morning headaches, struggle with poor concentration, feel irritable, and carry an overwhelming daytime fatigue. Inside the body, the toll is severe. Every time the brain hits the panic button to restart breathing, it dumps stress hormones into your system, causing massive blood pressure spikes. Night after night, this mechanical stress leads directly to hypertension, heart failure, and stroke. This chronic sleep disruption also damages your metabolism. It throws off the hormones that regulate appetite, making rapid weight gain highly likely, and significantly increases the risk of developing insulin resistance and type 2 diabetes. Leaving sleep apnea untreated means allowing a highly corrosive condition to run unchecked in your body. It quietly damages your heart, brain, and metabolic systems over years of interrupted sleep. To measure exactly how much damage is occurring, doctors use either an overnight sleep study in a lab, called polysomnography, or a home sleep apnea test. These monitors track your breathing effort and oxygen levels throughout the night. These tests are used to calculate this gauge, the Apnea-Hypopnea Index, or AHI. The AHI is a metric that averages how many times your airway collapses per hour. Doctors classify your condition as mild if you have 5 to 14 events, moderate at 15 to 29, and severe if you hit 30 or more collapses every single hour. Getting an accurate AHI score takes an invisible, exhausting struggle and turns it into a concrete, highly treatable medical target. The gold standard for treating that target is continuous positive airway pressure, commonly known as CPAP therapy. CPAP acts as a pneumatic splint, delivering a gentle, constant stream of air to keep that collapsing tube inflated. The machine doesn't breathe for you. It simply holds the roadblock open so you can resume rhythmic, uninterrupted breathing. Healthy breathing during sleep is the foundation of your overall well-being. By resolving this mechanical roadblock, you halt the stress on your cardiovascular system, restore your brain's oxygen supply, and get your life back.